Good afternoon. Thank you all for being here. Thanks to the media for helping us deliver this important message. I also want to thank our incredible staff that's been working day and night. You truly have been healthcare heroes. And as you can see, I've got many of our healthcare heroes with us today. These are many of our physicians, those that have been fighting this battle. As I said, day and night. They are from all different specialties. But we're here for a purpose, and that's to deliver a message, a singular message on a united front to encourage everyone to get vaccinated. We are seeing unprecedented numbers again here with COVID. Our COVID rate in this county is 3 times what we're seeing throughout the rest of the United States. And we're just asking everyone to get vaccinated as soon as possible. We know the vaccine is safe, we know the vaccine's effective, and we all stand behind the vaccine as a way to save our friends, our neighbors, and our family members. I've heard too many stories about patients who regret not having the vaccine, who in the throes of COVID or in the throes or about ready to get intubated and put on a ventilator, that they say they wish they had gotten the vaccination. We're seeing too many of our friends, neighbors, and family members, young people, otherwise healthy people who are now on ventilators who are dying. We're losing 8 to 12 people a day in our health system, and it's not necessary. So don't wait. The vaccine is your best defense against COVID-19. I had hoped to be able to share positive news about our numbers. Over the weekend, we started to see a little bit of a drop-off from a peak of 690 patients in the hospital. We had actually gotten down to 601. But yesterday, we admitted 92 COVID patients. That's the highest total that I certainly can remember throughout the pandemic. We discharged 49. But that 92 is just chilling to me. We have 639 patients with COVID in our hospitals, 119 in the intensive care units, and unfortunately we have 96 that are on ventilators. And as you know, that with COVID, that's the end of the line for treatment, is to put someone on a ventilator, and we know that once they've done that, that the prognosis is not great. The other thing that's very worrisome is we're seeing more and more children. You've heard me say before that throughout the pandemic, we usually had 1 or 2 children with COVID. Today we have 15 children at Golisano with COVID, and we're opening up all sorts of different spaces in the hospital for these young patients. And again, many of them are otherwise healthy. Our hospital right now is at capacity. Our ICUs are 98% full. Since the beginning of the pandemic, we've lost 909 patients to COVID. The vast majority of these were unvaccinated. There's so much misinformation out there on the internet. And I'm asking everyone to please trust your physician. We've had years of training. We're scientists. We keep up with the journals. We know the research. We understand the vaccine. We understand how it works. And we believe it is safe and effective. We are a better source than the internet or social media, and we encourage everyone to please talk to their doctor about it. Trust us when we tell you that the vaccine is safe and effective. It is heartbreaking to see what we're seeing in this hospital, knowing what the alternative is, that we could be saving these lives. At this time, I'd like to introduce Dr. Stephanie Stovall, our Interim Chief Quality and Safety Officer and a specialist in pediatric infectious disease. Dr. Stovall?
Thank you, Dr. Antonucci, and thank you all for coming today, and thank you all of my colleagues for coming. As a member of this group behind me, though, they are doing the vast majority of the work right now as physicians. I can tell you that physicians are spending hours upon hours each day, each week, talking to patients, answering their questions, trying to bust myths, if you will, and trying to encourage the patients to do the things that they can do to prevent COVID. The most powerful tool that we have right now is vaccination. One group I'd like to highlight for you is pregnant women. Pregnant women, lactating women, and those who may become pregnant or who are looking to become pregnant. For a couple of reasons, this is a really vulnerable population. One is that COVID hits them harder. Second is that many of them are carrying a life inside them that is also going to be hit harder. Our neonatal intensive care unit is full. It's overflowing. It's never been this full before. Part of that is because pregnant women who have COVID are more likely to deliver early. They're more likely to have pregnancy complications. It is recommended that every pregnant woman, every lactating woman above the age of 12, and every woman who thinks she may become pregnant get vaccinated to try to protect her and her baby. We all recommend this to all of our patients. Likewise, we recommend it to every person eligible over 12 years of age, 12 years or over, to prevent this illness, to prevent having to have those conversations with patients where they say, I wish I'd listened. I wish I had my answers, gotten my answers early enough to get the vaccine so that it could have prevented my hospitalization or death. So on behalf of all of these folks, we beg you, please go get vaccinated. Our vaccine clinics are open Tuesday, Wednesday, and Friday at Gulf Coast. All the vaccines are available. It's open from 7 to 3:30. There are also other places in the community that you can get it. And if you have questions, you can absolutely contact your doctor or any of these doctors, and we'll be glad to help answer your question. Now I'd like to introduce Dr. Dougherty to us. He's our medical director for emergency management and has been working exceptionally hard over the last year and a half. Dr. Dougherty.
Good afternoon. Emergency medicine is a team sport, so not only do I interact with the specialists behind me, but I proudly work 24/7 with the nurses and the support staff that have risen to meet the increased demand. And I thank them for all their hard work and dedication during this latest peak of the pandemic. Let me start by answering a few questions that I routinely get asked. Are we tired of walking into the room with a pit in our stomach, knowing that a young vaccinated patient who came gasping for air probably won't make it out of the hospital? Yes. Are we tired of seeing the expression in the eyes of patients as we confirm their fears, or seeing the tears of sadness when I tell a mother that her child has COVID? Yes. Are we tired of hearing all the reasons why the COVID positive patient didn't want to get the vaccine? Or listen as they question themselves out loud, should they have gotten it sooner? Yes. Are we tired to understand why they're so adamant against the vaccine but so quick to roll up their sleeve for the experimental drugs such as Regeneron, let alone asking for unproven therapies? Yes. Are our ED volumes unprecedented for this time of year, and do we need to continue to care for admitted patients in the emergency department until the bed becomes available upstairs? Yes. Are we tired of working 10 to 12 hours a day with N95 masks and all the PPE, with waiting rooms just as full as when we started our shift? Yes. But are we too tired to do our jobs? Absolutely not. We are steadfast and unwavering in our commitment to care for this community's medical needs. We've expanded our ERs, open trailers, started MAB clinics. Physicians and nurses have taken extra shifts to meet the demand. Our goal has and always will be to care for you and your families in this community. But 49% of the people that walk in the emergency department are related to COVID, and that number is insane. No other disease demands these amount of resources, including BiPAP and ventilators, and all of it could be prevented with vaccination. Help us stop this madness. Get vaccinated. In addition to being an emergency physician, I'm also a medical toxicologist, and I understand the concept of not being the first or last person to get a drug. So I understand the initial hesitancy, but now there's been over 5 billion doses given. 39 million daily. What are you waiting for? I've heard people say they're afraid of not only the theoretical short-term, but the potential long-term complications of the vaccine. I've seen the short-term complications daily, including death. And for me, that seems to be a real long-term complication for you and your family. People are requiring hospitalizations at an alarming rate. And stop thinking that it's just the elderly. 20 and 30-year-olds have died during this season. Most of our admissions, let alone our deaths, could have been prevented with the vaccine. Are we tired of not having a consistent treatment that will work on our patients? Yes. Will we continually try tirelessly to find one? Yes. In the meantime, should everyone get vaccinated who can? Yes. And lastly, should people be afraid to come to the emergency department for fear of getting COVID? No. We're probably one of the last places that I guarantee you everyone is wearing a mask. Thank you.
Happy to take any questions that you might have for anyone in any of our docs or me or anyone else. Yeah.
Dr. Antonucci, one of the things I wanted to ask you is, over the last several weeks, you come, you do these press conferences, and you say a lot of the same thing. We talked last week about the frustration that you have that people aren't hearing that. And watching the physicians behind you all as you spoke, I see everyone nodding their heads. How is this sitting on all of your folks when they read comments online calling this a hoax or some of the misinformation? How does it affect all the folks behind you?
Well, I think you can tell, from hearing Dr. Dougherty speak, the emotion and what the clinical staff are going through and how difficult it really is. When you start your day and you've got 40 patients in your office and you spend the first hour talking to 4 patients for 15 minutes each, trying to convince them to get the vaccine, and you're unsuccessful, how frustrating that is. So they're all feeling it. I want to say, though, that our vaccine clinic is getting busier, thank goodness. We scheduled, 1,000 patients, I think it was. So more people are coming in. It's just that we need them to come in faster and for more patients to get vaccinated.
And if I could just ask Dr. Dougherty, this is the first time we've seen a group of physicians stand out here sort of for a joint appeal. Do you have hope that this will work?
If it gets 1 or 2 more people vaccinated, then it's worked. As far as visually seeing people, we've written letters, we've spoken out, we've been on the news, we've been on the radio. Our message has been constant and will continue to be constant. We need people vaccinated. It will help.
So right now the hospital is at 100% staffed operational capacity. Basically, you're full.
Right.
So what does that mean for other community members, COVID or not, who might get sick and need help? And I know in the past we've talked about needing potentially use overflow rooms like community rooms or cafeterias. Are we at that point yet, or what does it look like?
Yeah, first of all, if you do need us, you need to come to the emergency room. We will be here and we will take care of you. But yes, we are looking at alternative space. We're taking areas that were otherwise storage rooms and we're using them as clinical space. We're doubling up on patients when we have to and when it's safe. So we're doing everything we can to meet the need.
Do you think you'll have to expand into some of those larger areas like the community rooms and cafeterias at this point, or?
It's a day-by-day decision. As I said, over the weekend we started to see numbers go down and we felt good about it. And then yesterday we were hit with a pretty large admission. So I think it's going to be day-to-day. We're going to watch it kind of bounce up and down, but we're hoping and praying that the general trend is going to be down.
At a Cape hospital, I know you all had to transition to a temporary morgue. Has that happened at any other of your hospitals, and do you anticipate that it will if it hasn't yet?
I'm not aware of that. Stephanie, you want to?
At this point, I don't believe that that's occurring in any of our other facilities. However, we do monitor that on a daily basis because we do have limited capacity for that.
With the monoclonal antibody treatment, are you still seeing an increase in people getting vaccinated, or are they opting for that treatment instead of the vaccine?
It's really hard to say because people who come in for monoclonal antibodies, they come in whether they're vaccinated or not. So I don't think people are seeing it as an alternative. We're trying to make it clear that it's not an alternative, that the effectiveness of the vaccine is much higher than with monoclonal antibody treatment. So it's hard to say what people are thinking and why they're doing it, but that's certainly not the message that we're trying to deliver.
Do you think at this point it's helped prevent any hospitalizations or helped treat people?
Well, we'd have to assume that it has, because the site is doing about 300 a day. We're probably doing about 50 a day. If you assume that a certain percentage of those people are going to come down with COVID and a smaller percentage are going to be hospitalized, we should be reducing that number by 70, 80%. Any other questions? If not, we thank you for being here. We will be available if any of you want to do any one-on-ones. Some of us can stay. Thank you.